Yep, we're on.
Hey, Charles? Charles?
Yes, sir. Yes, sir.
We're on, Charles.
You are?
We're on.
I don't see you.
I don't see you either. I don't see you either, but you're on.
No, but you took yourself off the camera. Only got the black screen.
Same with you. Something must be wrong with your camera.
So now I can't hear you. You muted. You gotta unmute.
What are you eating, Charles?
Please unmute your audio.
What are you eating, Charles?
You muted. I am eating granola. Granola. Hello, everyone. This is Uncle Charlie and Brother Mel. Right on popcorn.
You know, I listened to the governor's press conference today, and now I understand it. It's about us wearing our masks. It's about us. Yeah, it's not about visitors. It's not about that. It's about wear your mask. It's your fault, Charlie. It's our fault because we're not wearing our mask.
No, but you know what? It's his fault giving information to make everybody feel, like the question was asked about hospital beds. What was his answer? Not to worry, because we're not like California. So basically, he telling everybody, do whatever you want to do, because, I mean, that's what I got off of it. I don't know how you felt, brother.
Well,
so it's a message because the epidemiologist went the other direction. So.
But, you know, I don't know if the governor thinks that when he does these press conferences, that everybody that's watching hasn't been paying attention over the last 4 months. I don't know if he just thinks it's this first time, like an inauguration speech, that everybody is watching without having any knowledge of what he's talking about. Because if you have been following this, if you have been following the roller coaster ride of COVID-19 here in Hawaii, then you know that it's very hard to understand the logic that, in fact, when things were going well, we locked down. When the numbers were coming down, we locked down, we shut things. My wife is coughing, I'm getting worried. Sorry. And they told us that, remember when they started the phases, phase 1, phase 2, he said, well, we got to go 14 days, consecutive days of decreasing daily cases. That was the deal. Once we get 14 days, we move on to the next phase. See, I don't know if he realizes that we watch and we pay attention over the last few months. So he comes out and he really, I didn't see any indication of aside from him saying that they're going to, reassess. He'll meet with the mayors tomorrow, and that they'll, certainly we reassess every day. Certainly. But for those of us that have been paying attention, it makes no logical sense that when things are getting worse, when the numbers are rising, the highest it's ever been today, 41 cases, that we start to open up, and we continue to open up, and now we're going to open up to trans-Pacific passengers. Now, let me make something very, very clear, because I just got a message from a dear friend of mine that said he has not heard me talking about the devastation that the businesses are going through. Now, I think I've said this every single day, if not every other day. I know more times that I can remember, our position has always been that, yes, we need to open up the economy. Yes, we need to get people back to work. Yes, we need to take care of our small businesses. That's always been my position. The problem I'm having is that the system that they have in place right now isn't working. It's not working. The system that they're proposing in Alaska has already been shown to fail. In fact, their numbers went from 40 to 400, 10 times more cases. So we know that the plan that they have more than likely will not work. And then we have a second option. We had the three doctors on last night, along with former Mayor Councilmember Yukimura, of a 2-test, 6-day quarantine. Now, is that perfect? No, it's not perfect. Is it better? Absolutely. So I just want to make it real clear to all of you, especially those of you that are out of work and not sure if you'll ever go back to work, and for all you business owners that are struggling right now, we need to open the economy, but it has to be done in a way that is safe for all of us, including your businesses. You see, if we don't take this seriously, your business will open up. And like I just read an article today, Las Vegas is now contemplating shutting down the casinos again. That just came out this afternoon because they opened up. And we know what happens when you open up. If we don't open up safely, yes, your small business will operate and you'll get your guys back to work. And probably a month or two later, if we don't have a handle on these visitors and this virus that's here circulating amongst us right now with community spread, your business is going to close again. And we've said it over and over, it'll be demoralizing to everyone. So our position, or my position, I won't speak for Charlie, but my position is yes, let's move towards opening up the economy, but we got to do it in a way that's safe, not just for the visitors, but more for the local residents and business owners here on Kauai. I hope I made myself clear.
Well, I think you have, sir. I think you have. But, you know, I've always been erring on the side of caution, not to shut businesses down. That has never been my position. My position is, yeah, you like being on fire knife dancer. You make sure you have all the safety protocols, because no use you go out there in front of the crowd, twirling your fire knife, and we don't have any safety precautions. I think flying through the crowd and burn people, maybe kill someone. Then you can say goodbye to that entire luau show. You know what I'm saying? And that's what we're looking at. Relatively simple approach, and that is, let's get something safe in place and go for it. But we don't even have that safe in place. We've got this notion that, you know, we're gonna go for it, and if it gets bad, we just shut down. Okay, I mean, if you want to take that approach, fine. But what did we gain? Nothing. Did we get people hurt in the meantime? Sure, we did. I'm not saying that we're not going to be able to avoid it, but we want to do the best time possible. And I think last night's the numbers showed how we could reduce that, you know, that amount. And, you know, for it to not even be considered, it's depressing. I can see the comments, and yes, you know, all of you are correct that it doesn't make sense. We've kind of, in the beginning, we've always said this, and that is, what is the threshold that will determine when you open or when you close? Because we were at a very low threshold in the beginning and we stayed closed. Now our threshold is very high and we're opening up. We're going to open up, okay. What is the flip side to the safety? What is the safety net that everyone can depend on? Get away from the hospitals, because that's inevitable. Yet there's some of you out there that think that, well, this is like a flu. Yeah. Flus don't cause amputation of limbs, because we know that this virus does some funky things to the blood and it creates all kind of havoc, vascular one. Then you've got flus don't develop very, very bad respiratory problems unless you already had an existing respiratory problem. Okay, so you know the thing is, it gets scary in a sense that we can open up. And it's almost like saying, like when you want to build a housing development, you want to put 100 new homes in that area. But then you have to have that threshold of having a fire department, right? Should something happen. You cannot go put in the homes and not have those kind of services there. Are you going to expect the motoring public to be in danger because you're sending on fire agent way from the other side of the island? No. You try to put, when you build one brand new subdivision, you make sure that you have a fire department there that can handle that subdivision. And that's all we're saying. Let's open up, but let's have at least some safety valves in place.
Well, today I saw, you know, musical chairs. That's what I saw today at the press conference. I mean, there were many direct questions asked by the media and very frequently they were just getting away from the question and talking about something else.
Yep.
He did say that he's going to meet with the mayors tomorrow. Email our mayor if you whatever island you're on. Email your mayor. Let them know how you feel. I'm hoping that our mayor will say no, we're not ready, and till we are assured that the process in place will work. What is the best chance we got for securing our residents? That's
Yep.
not in place right now. They don't even have the process that they want to do in place right now. The whole quarantine issue is a mess right now. I just got a message from a woman who the neighbor just came in to the house across the street, and the husband asked the lady, "Aren't you supposed to be on quarantine?" Because she was out driving around, and she said, "Oh no, I came in on a ship with only 24 people, and KPD said I didn't have to quarantine." Now, number one, I don't believe her, but number two, it's living proof that this is not working. This lady came off of a ship, probably a sailboat that's parked out in Honolulu, with 23 others, and is not quarantining. So we know it's not working. And while Kauai is doing a heck of a job, a much better job than the other counties, it's still not working. People are slipping through the cracks. They just arrested another guy today for violating the quarantine. Yeah, demanding that the front desk call a cab or an Uber because he wanted to go out, and they told him no, cause a problem, he gets arrested. We know that this isn't working, and that's without the August 1st opening. So the 6-day two test method, I think for me and from the comments I've seen and the people I've spoken to, would be sufficient. Would be sufficient to have us as safe as possible. But we still got to get a handle on the quarantine. We still need to get a handle on the quarantine process, because I don't care how much you test, and the ones that don't take a test and they're in quarantine and they're out and about, then our safety is compromised. And I think that is where the frustration is. And we really got to get a handle on this. And the businesses, one of the things I haven't heard, and Kauai, as we heard from the council chair, Aro Kanashiro, $50 million in the rainy day fund. The legislature put $2.8 billion into the state's rainy day fund. What I haven't heard is our legislators, both at the county level and at the state level, talk about using those funds to help keep our businesses afloat and our people that need funds, our people that haven't received an unemployment check, the people that are struggling and don't have any income coming in. I haven't heard any discussions about how the state and the counties understand the rainy day fund. Trust me, I was there. We talked about that money and the limitations to use those funds. But right now we are in a crisis. We are in an economic disaster. We are in a situation where I believe those funds should be used to protect and to keep our families with income. I have not heard that discussion. Everybody's relying on the federal government. Well, we have a rainy day fund. The state has a rainy day fund. While I hate touching those things, I also hate seeing our families suffer and struggle. So that's the discussion that needs to happen. We need to have that discussion at the legislative level, not at the governor's. It's at the legislative, the councils, and at the state legislature. It has to happen, because we cannot continue not helping our people and then using the tourism as the safety blanket. Like, once we get the flights back and once we get all the tourists here, you guys all going back to work, everything going back to normal. That is not what's going to happen. And we all know that, because the other places in the United States are seeing it. We should be smart enough to learn from what's happening in other places. So anyway.
Well, real fast. What is very, very odd about the predicament that we're in is they will take certain ideas and say, look, this is what they're doing. They'll follow that. But then the ones that's really critical, especially those ideas or those states that have booming numbers, they totally disregard that because they say it doesn't apply to us. So, it doesn't work that way, gang. It doesn't work that way. Because I know one thing for sure. If you want to go skydiving, you all will have to jump out of the plane a certain way and pull the cord at a certain time. If not, you're going to die. Plain and simple. You can't be taking, well, in California, they wait until they're 10 feet off the ground before they pull a chute. Okay, fine. I don't want to be like California. But like we said from before, we see the numbers. And like the doctor said from the get-go, whatever we can use that will better equip us to handle this problem, we should take from that. But we're not even doing that. That's the thing that gets really, really unnerving. And like some of the viewers are saying, yeah, all we're doing is getting scolding for not using our damn masks. That's right. I mean, I don't know about you, but when I went to school, after a while, I got very rebellious about getting scolding so much. Don't be sitting in a corner. I did. I found the corner right next to the window because I climbed out and we're playing play with the Jungle Dream after that. I never stay in the room, but I was one of those kids. And there's gonna be some tough times ahead. But I hope, Mel, that everybody errs on the side of safety, which they have been doing. There's no doubt they have been. But now the people that basically run this state, they gotta start opening themselves up and say, hey, do you guys know what the hell you guys are doing?
Well, two things. Number one, Tenere Mafala, why would we want to follow best practices from the continent where it's falling apart? Why don't they follow our best practice? Because obviously our numbers are better. Why would we want to continue to go follow placing, putting our future in the hands of in a model that isn't working? Tenere Mafala said that. I thought that was brilliant. And the other concern is when I hear the governor talk about he's been in communication with all the medical personnel. Last night we had 3 doctors on, including our own Dr. Evslin, who's very concerned about capacity. We're listening to the mayors and governors from other states that are saying, if we don't change direction, we are not going to have any capacity. So where he gets that from, what medical doctors, I know it's Anderson and Park, and he should be talking to the private doctors outside. Anyway, Dr. Miscovich is, boom, coming on right now. There he is.
There he is.
Mr. CNN himself.
Yes.
World famous, known across the country now. He's connecting to audio. He cannot hear us yet.
Oh, no, he can't. Right there.
It's Anderson and Park. And he should be talking. He's watching the stuff on Facebook. Yeah, we know. We got real good with this Zoom stuff. Now we know all the stuff, all the tricks. How are you, Doc?
Hey, pretty good, guys. How are you doing?
Welcome back. Good. Welcome back, boy. I tell you, we had several viewers asking to bring you back. Charlie and I had the discussion a while back, and we know you've been really busy. We've been watching you on TV quite frequently now and again. You broke the national news now. You're like big time. So, we're just so honored to allow you to give us an hour of your valuable time. Lots of things have changed since you've been here in the show. Yep. And man, we're gonna get right into it, man. You heard the governor's press conference today. It doesn't, although he's considering or reassessing or whatever, it looks like we're headed for an August 1st opening of the state. Looks like we're headed for an August 1st opening of the state with a single pre-test 72 hours before people leave. And we want to get your thoughts. I have no idea what you're going to say, but we're going to have fun either way.
Wait a second. You guys know exactly what I'm going to say. I'm going to say the truth, and I am going to tell you straight up. If we do what they're talking about, by October, this state is shut down completely. There is just no chance at where we are right now that we will successfully be able to then open up for tourism and then be able to, feel like our population is safe. And I agree with you guys completely. It's, yes, I feel for the businesses. I have so many friends and patients and everybody, but it doesn't help us if we shut down and open up, and if we have to shut down again a second time, it doesn't help us.
Doctor, let me ask you something. I think from a very simplistic point of view, you're a noted expert, and I congratulate you on that, because I'm not one to watch CNN, but when I saw it, I went, oh boy, yes. Now I'm a fan of CNN. Knowing what you know and giving all the necessary tools for this government to maybe make some sense of what needs to be done. Why do you think they're taking this path? It seems like it goes totally against what common sense would dictate at this point. And they always talk about, well, the science behind it. We don't even know what science they're talking about because, you know, we brought on like yourself, we brought on Dr. Schwartz, who's done a study with you, and we brought on Dr. Kimball. You know, a lot of people at UT Medical Center that deal with this thing all the time. And their opinion is, no, they're going the opposite way. I mean,
Exactly.
so
Yeah.
what do you think? What do you think is going on? Is there someone other than a medical professional up there in the administration advising them?
Well, I think you have to understand there is no medical professional advising them, you know, because Josh is still kind of on the side, you know, over with HIEMA. He's not really fully back in. And then you have Bruce Anderson, you know, Bruce is a great guy if we had like some bacteria in our water or some bugs in your garden, but Bruce is not a physician. He's an epidemiologist. So, you know, when you have a pandemic like this, which is a medical pandemic, he's really not in a position to be an expert. And Sarah is a hard-nosed epidemiologist that kind of just follows the CDC guidance. And we need broad thinkers, right? We don't need cut and paste and just say, well, this is what is said, because you know what? We're not Virginia, we're not Texas, thank God, or those places. So there, right now, there is no medical expertise that's really guiding or directing this process at this stage. I've had real positive contact with Dr. Sarah Kimball, who's an epidemiologist up at the Department of Health. We worked really well together on the Halinani outbreak. And so I think there are really solid, excellent people that are throughout the organization. But you guys know, with where you've come from, it all starts at the top. It all starts with the leadership. And it's clear our governor has had a hard time making decisions, and he's kind of deferred a lot of those decisions. And I think it's also clear, we all know that the majority of the decision to open our state up right now is coming from the tourism industry and the business industry. I don't think it's really, there's really not a lot of medical advice that's coming in. We're opening up and it doesn't matter.
That's what I got today from today's press conference. It was pretty evident today. I thought with the uptick of 41 cases, more than we've ever had. You know, we've, like Charlie said, we've had Dr. Kimball from Utah. You've been on several times. You were from the beginning, Doc. You were on target with the testing, the need for testing. You over 50% of the state's testing was done by you and your facility, your company. You have never changed your direction as far as testing. It just has never changed. We've talked to Dr. Kimball in Utah. We've talked to Dr. what was his name? Something. O'Carroll. We've talked to the 3 doctors last night. We've had many medical professionals. We've had the CEO of Hawaii Pacific, HSC, Hawaii,
Health,
whatever it is, Health System Corporation. We've had so many experts. Today, someone to my partner at work told me, "Wow, bro, you guys bring the people on that should be advising the governor. You guys have, and I agree. But the governor is, I agree with what you just said. And I've said this from day one, from my very first Facebook Live when he made the press conference. And I hate repeating this, but it's true. It was evident from that day he was surrounded by the visitor industry. He wasn't surrounded by medical people. We know that testing is vital. We've heard that from you. We've heard that from Dr. Josh Green. We've heard that from everybody. And yet our state is second to the last in testing as it relates to the percentage of your population. Second to the last. And it's like less than 6%. So I'm really starting to think and believe now, it was always my theory that they didn't want to test because they didn't want high numbers, so we could push the opening of the visit industry. It's very clear to me that's what the case is now. Because as we have increased testing, obviously, we have come across more cases. But we have a plan in place for one pre-test and then they're free to go, free to do whatever they want. there isn't. I don't know. Did you watch last night, Doc, with the three doctors
Yes.
talking about the 2-test 6-day quarantine? And I don't want to put you on the spot, but I
Oh,
mean, that would be
no.
wouldn't that be a better option for Hawaii right now?
Hey, let me go back to that. Absolute outstanding guest you had last night, 100% behind what they said. I've been advocating the two-test theory from the time we started to talk about it, and they perfectly showed the science between of why a two-test option is where we should go. And that's as good as we're going to get. I totally loved your show last night, and all the way around. So I am fully supporting that. And there are some of the points that were brought out were so important. I'm getting asked all the time. You can't find a test on the mainland right now. You can't just walk into anywhere and say, "Oh, hey, I'm going to Hawaii. Give me a test." You know, in my national role, which I don't know we'll get to, I'm dealing with organizations, and I'm on the lead calls because I'm heading their testing programs, where we're sitting with LabCorp and we're sitting with these large national labs. We're asking them to acquire and have agreements for 500,000 to 1 million tests a month in some of the programs we're launching. That's a pretty big customer, right? And we just got a call as of this morning to tell us that our prior agreement of having a 24 to 90 or a 20 or 48 to 96 hour turnaround is now going to be pushed back, even with that size of a customer, to 5 to 6 days at best. The mainland is overwhelmed right now, overwhelmed, and it's so to think for this fairy tale to be going on, that we're just going to open up August 1st like everything is perfect, is just where's the honesty? Why can't we look at the people of Hawaii and just give them an honest answer? And I think Josh did kind of say today he's really worried about opening up August 1st. But yeah, we can't do that. We can't be thinking we're just going to open up. Let me give you an example. Right now in my mainland role, we're dealing with trying to set up emergency 200, 225 bed pop-up hospitals in Arizona ×2. There's need for them in Texas. 50 of the ICUs in Florida are now overrun as of today. This group that we're working with, we've just got notification that likely in the next 7 days, we're going to pop up another 200-bed hospital in Atlanta in a convention center. The mainland is absolutely at its all-time worst. So let's transition this forward. So we're going to say, hey, you're coming from Arizona, where 1 out of every 5 tests is positive. They have a 20% positivity rate. Do you know what that means of how many people are in Arizona right now that are sick with this disease? And those tests aren't even coming back in 5 to 6 days. And then look at Texas, same thing. The major urban centers, overwhelmed right now, overwhelmed. And we're just going to say, oh, hey, Texas, California, Florida, come on to Hawaii. Why don't you? My God, those poor people can barely survive. We need to know that they're not going to have the disease. I don't know how else to say it, but it's a disaster in the mainland, and our numbers all-time worst. So you don't have to be a mathematician or an epidemiologist to see our curve is going this way. Our curve is another week from passing all of our all-time highs. And we're not doing anything to change it. We're not shutting anything down. People are still going to the 4th of July. They're still doing everything. So there's nothing stopping that curve from increasing. And projected out 3 weeks when we're going to be supposed to be opening, look where we are.
Doc, let me ask you, what is your thinking? You know, it seems pretty evident that, and I made an earlier comment that, you know, when you hear the governor talking about, you know, there's high numbers in other areas, but our conditions aren't the same, so therefore they're not going to worry about it. But we talked. He made mention about the bed space right now that we have here. So he slanted it to the left on that, and yet Park kind of went to the right, saying that, you know, if you gather and you get complacent, this is what's going to happen. So you got the people at the top talking this kind of messaging. it kind of puts the people in Hawaii into that realm like, well, you know what? They're making it sound like, yeah, it's pretty cool. And then they go and get sick or they go and get infected. And I think that's why, from a local standpoint, that thing keeps on bouncing up. I think there's need to be some, and that's why I wanted to ask you the question. What can be said to actually talk some sense into the people of Hawaii once and for all that's got to stay clear of what they've been releasing because apparently it's not doing a good job. Something's got to be said for them to understand how serious this thing is.
Yeah, I mean, I think you guys probably did see my CNN piece, and then I was called a couple times by the news today, and I want to flip this back. This is something I did say when I was talking to CNN, but they didn't put it on. We can't rely completely on the Department of Health or the state government to stop the COVID crisis and the pandemic crisis. You guys were spot on at the beginning. I was listening to your show right at the beginning about saying the amputations and just how this isn't the flu. This is the most virulent, unusual disease we've had in a century. What we need to be doing is thinking about how did we get to this successful area where we were the 0, 1, 0, 0, 2, 3, and being in the front lines, looking at thousands and tens, we probably looked at 60,000 people in the face, and of that we tested a certain percentage. The people get the credit. They listened. The people of Hawaii, when we shut the businesses down, they listened, they separated, they did not go with more than 2 people together. That's why we were so successful. The people listened. So the people of Hawaii have to realize it is back in their hands, and they have to go back to self, that 6 to 10 feet is perfect. Using the mask is perfect. Being outdoors, if you're going to be with family or friends, and separating is so key. But we can't rely on the Department of Health. And I'm saying this in all fairness, there is no Department of Health in the United States of America that was prepared for a pandemic of the century. Everybody's learning on the fly. So in all fairness, everybody is. And I'm talking to other departments of health across the United States, and they're all flying by the seat of their pants right now. But at the same time, it has to be a duality of a balance between the people taking responsibility, which I do believe we have let our guard down as citizens of Hawaii for multiple reasons. And at the same time, we need just some good honesty from our leadership, because you guys saw it today, and we were just getting talk around every question, every answer, and everything's okay. And we expected this. Oh yeah, that's okay. We're prepared. You're all safe. We had our all-time high, but no, don't worry, we're okay. Come on,
that's what I struggle with. I mean, we shut everything down. You're right about the Department of Health throughout the country, and they're also up against administrations, whether it's cities or states, that are anxious to open up. Many of them already opened up, and they're finding out that they need to shut back down. And we all know the devastation that creates. It's really weird that when we were early on and we started to shut things down and we got really flat, we kept things shut, and then we started opening things up, numbers started to increase. But you would think at this point that bars would be shut down, that these non-essential operations that are pretty much petri dishes for this virus would be shut down. There was no mention of that today. Everything was focused on getting the tourists here. You guys, all of you, need to wear your mask. All of you need to stay at home. He even suggested that employers telework where they can. Basically, he's saying, all of you stay put. You guys practice the safety so our visitors can come in and enjoy themselves. It sounds like, I repeat myself pretty much every time we have a new guest, because that is the constant in all of this. In our state right now, the constant, the thing that doesn't change, is the state's rush to open up the visitor industry. And for me, it's very hard to accept. I'm not a doctor, I'm not a scientist, I'm not an epidemiologist, not a mathematician, but my God, if you wake up in the morning and you get 41 cases, more than you've ever had, I think the discussion is, what are we going to shut down first? What non-essential functions in our communities that are high risk should we be shutting down? No discussion about that. It's no, just keep doing what you're doing, but wear your mask and get ready for the economy to bump in August. That's what I heard today.
Well, yeah, you are correct, and I hate to say it, but yes, we all know what they are. Remember, indoors versus outdoors. Indoors is the place where the spread will occur the most, up to 300 to 1 more virulent and contagious indoors, and I did say, oh yeah, I did say this on CNN, but let me just say it to the viewers again, because I don't think anybody at all is talking about it here locally. We have had a mutation of the virus, okay? The mutation is now confirmed, and it is not a mutation that has made it more deadly. It hasn't changed the way it's identified with the swabs, but one little amino acid in the chain has changed to, now we call this the G mutation. And that G mutation, everybody's seen the little spikes that come out of that little globule of fat. So what happens is those little spikes, they find the side of a cell, and there's a little ACE2 receptor, which is this little sewage hole there that they have to stick into and then shoot their viral particles in to replicate. Well, early on, those little particles would break. The little spikes weren't all that strong, and they would bounce off. The mutation has made those spikes and their ability to attach and hold on almost 10 times more able. And so what you have now is same virulence, meaning it's not killing you more, but the contagiousness and the ability for those things to latch onto our cells is significantly increased. So we're not talking about the fact that that's likely also why throughout the United States, we're having a much larger spread, because it doesn't take that many respiratory droplets where it can stick in your nose, into your mouth, even into your eyes. So that's an important part of this too, which, people were looking at the olden days 3 months ago to now, what it took to get the disease then versus now can be just a passerby with a deep breath blowing it on you. Very big point that the public has to understand, which is another flag in the ground to say, wear your masks, stay away from people that could be breathing on you, put it out there as far as you can, get out there from 6 feet, get to 10 feet if you can, right?
In the beginning, I'm so glad you brought that up, because if you go back to one of our earlier series, I had asked that question. I said, hey, is this thing mutating? And I think back then, no one could say if it was, because I always felt that this thing almost had this appearance like it was getting stronger and stronger. It was like it was getting harder to shake. And I'm glad you say, so basically this thing is like, it built up strength, and it's like super glue. It's just stuck and bingo.
Yeah, I was telling this story, and someone looked at me and said, not a medical person, and says, "Oh, so it's got better Velcro." And I said, "Yeah, I kind of like that, man. Yeah, that's a good analogy. It's got a lot better Velcro, man. So you can just jump on and stick on there in a second." But again, it's not killing you anymore, and that's the other question people were trying to say is that. Not as many people are dying. Well, yeah, but we have the reason that not as many people are dying is that we are finally getting little headways into different things that can help reduce the death, and these are you're still spending 40 days on a ventilator or 30 days in ICU and surviving, and you're coming away with tons of complications, and then we're saying, oh, but you lived, but you lost a leg, or you've had a heart attack, or how many 20 and 30-year-olds or 40-year-olds are having strokes from this? This causes massive clotting, nothing like we've ever seen with the virus, where the clotting factors just go crazy. And we're now seeing that surge in the 20 to 40-year-old age groups. And the bottom line is that they're the number one fastest growing demographic. and the complications are, yes, they're not dying as much, but they're having some pretty big complications. My dog is hitting his belt.
Oh,
He's
I, you
trained.
know,
He's
I
trained.
thought,
My dog is trained to rub the bell to go out. So let me let him out here. Come on.
okay, I thought it was my
Come on,
neighbor.
get
I
out
was
of
thinking,
here.
what the heck?
Go.
It sounded like
No,
somebody was breaking glass.
You
Oh,
thought it was
that's
reindeer, right? You thought it was reindeer. And
well,
it
I
was,
don't know what the heck it was, man.
well,
You never
well,
know.
Doc, I'm very impressed. You know, you have your dog trained because what I do is I hit the table several times when I want my wife to give me some money to go out so I can buy something.
You
That's
know,
good.
I know a lot of people talk about the governor keeps saying that we have the lowest mortality rate in the country. You know, it's like you talk to a guy like Charlie who lost a brother. I'm going to read this because, you know, this is a friend of so many of us on Kauai, Laura Richards. I don't know if you know Laura Richards. She was a general manager of Honolulu Colony Resort. When we had the flood, she opened up the restaurant. She fed everybody out there, the community. What a wonderful person, married to Tommy. Well, last year, and her and Tommy went on a road trip, and this is a good, loving couple, amazing guy. Tommy was an amazing guy. June 20, June 28th, she posted asking for prayers for Tommy. They were in Arizona at the time, and he had contracted the COVID, and he was in ICU June 28th. And unfortunately, I'm reading this because she posted it, so I'm assuming she's okay. I didn't ask her permission, but she posted it on Facebook. But this was just yesterday. She posted, actually 14 hours ago. She posted, our last incredible road trip a year ago. I want to thank all my family and friends for your love and support over the last weeks. It is a great sadness and a broken heart to tell you that my Tommy has moved on to the heavens to look over us. He's in God's arms. Bless Tommy. The kindest and most gentle man I've ever known. His constant love and support was my strength. Mahalo nui loa to all. Rip, my love. Okay, but what she says next is what I want to get across. COVID is real. If you love yourself and others, take all precautions. So to all of you out there, you want to brag about a low mortality rate, go tell that to Laura. Tell that to Charlie. Tell that to all the families that their loved ones, like you said, have had amputations, have permanent lung damage, have permanent kidney issues and vascular problems. I mean, you know, I hate it when they talk about the recoveries. What's a recovery? A recovery from COVID, but you now are subject or very susceptible or vulnerable to strokes. That's not a recovery. You went from one goddamn problem to another. So, you know, let's bring the reality in here and let's treat this virus with the seriousness that it deserves. And that's what I didn't hear today. I didn't hear that at all today. And
Well, here's the alternative. You know, when I look at this and I hear, oh, don't worry, we're great. You know, there was a question asked, very appropriate question. What is the number that we will consider that we would turn it around? And I'm sure you guys heard the same thing. There was absolutely no answer. There was just a talk around it. Oh, okay. Well, but we're really good. Our hospitals, our ICU beds are really good. Well, wait a second. I mean, so that's the answer we're getting. What the people need a direct response. What is our leadership, the people we turn to? What should we as the state be looking at for a sign that things are going badly, right? And it's not waiting. Why don't we talk about, oh, you know what? Our cemeteries have plenty of spots out there, so we're good. Don't you people worry. These are lives. These are people's lives. This isn't about how many people are in ICU. It's preventing people to even get into ICU. It's not waiting to say, oh, we have 50% or 75%. That's too long. That's waiting too long, because that means there will be deaths that will go along with that. So I am so much in agreement with you right now on this. And who's going to volunteer to put their loved ones up, their tutu to be the first one to step in line? No way. No way.
Well, you know, I've always said this other thing too. You know, Mel and I have talked about this so much. It seems funny that, well, it's not funny. but it's asking what is the threshold? Because when we first started, the numbers were so low and we closed everything down. Now the numbers are so high and we're opening up. You know, I just couldn't understand that thought process, because we did ask Josh before, what would you consider the threshold? Because there's got to be something that causes this engine to start moving in a direction, and you got to know that number. But but because nobody's sharing it, it leaves it to speculation, and that's why everybody gets frustrated. And you know what I learned from this whole ordeal is that, as simple as we may be here in the Hawaiian Islands, we're pretty smart people. You just give us something to work with, and we can work with it. You know, we're not asking for give us on a PhD analysis. Just give us something, and we can take it. And it's just like, you remember we asked at one time, why is it so hard when someone's infected? Just without giving out names, just give us the location that they were at. Oh, because of HIPAA. But yet, when a bus driver got sick, oh, they give you the bus route, they give you everything. They give you what time he was on that route, blah, blah, blah. They gave you the world. They gave you the world. But now, you know, when we get these clusters, right? I can see here on Kauai, if the cluster itself is in one household and it stays in that household when it formulates. But you don't even know if that cluster as a family unit, they were outside of that house. And another thing, Doc, and correct me, and I wanted to get your feed about, you know, the contact tracing program. This is the way I saw it, and some people agree, but I guess that's the police mind that goes into the way Mel and I think, and that is, if you got a bus driver that's infected, the question is, did he get infected from a passenger that came on the bus? Or was a passenger infected first, came infect him, and then a passenger went and sat down with somebody else and infected that person too? Nobody knows that. So the thing is, with the contact tracing, we don't know if it's coming towards you or going away from you. We don't know that right now. And I think that's important stuff for the general public to know. That, you know, when they do these contact trace, if you was at Long's Drugs, if they can determine if that was a hot spot. Hey, was I at Long's Drugs on Friday, this date, between this time? Yes, I was. Do I feel a little different? Sure do. Uh-oh, something's happening. I better start monitoring myself.
Exactly. If you would look at the contact tracing programs, there's open source contact tracing program that's come out of Harvard and MIT that has been modified and distributed. There's probably about 4 or 5 high-end programs. And what these are doing is they're essentially allowing contact tracing to happen without giving up identities. And there's a neat one I was looking at yesterday, which you're putting out this neutral signal that another phone picks up and another phone picks up, and there is a specific ID to it, but it's so your phone will at the end of the day potentially say, hey, you know what, you at this point when you walk through CVS were 10 feet away from a person who then turned COVID positive, and you get to go, oh, wow. Doesn't say the name. It doesn't, doesn't give anything. It just, these little devices just twing a little bit and so there are really, and then you look at the South Korea model, which is what I studied extensively back even before we had COVID coming through. I mean, man, oh man, there are places that are taking away some of our civil rights, et cetera. What you got there?
What you got there, Mel?
I don't know if you can see it. It says COVID-19 exposure logging.
Yes.
This is on your iPhone.
Yep.
We went over this. If you go to, I'm going to do it right here in front of your eyes. If you go to your settings, and you hit privacy, right here, privacy, and then you hit health, you get COVID-19 exposure logging. There's a toggle switch. You just hit toggle right here. Boom. As you can see, it doesn't work. And it doesn't work because, and this is what Google and Apple, everybody got together and put this in all of their phones. It doesn't work because you got to apply for permission through Google for their API to get this to work. So they came out with this. It's in everybody's smartphone that had the most recent update. The state asks for, many states are using it already. And this app will notify you. It collects and stores exposure log for 14 days. So basically, it'd be like the Korea model, without any stinking names. Right here, the state has to ask for approval to use the API. This is here.
Jesus.
But they don't want this, and why, I don't know. And that's where the frustration comes, because we find out about these things. I don't got a PhD, I don't got an MD. These things readily available, and I'm not sure why they're not using it. They're not using it.
Yeah.
Minnie Cole, by the way, Minnie Cole is going to be our guest on Friday. From South Korea. She's in South Korea. She's a consultant that works with the government as on the government COVID task force. She's gonna be with us on Friday night at 7:00 to go over what they're doing and how they had that whole little uptick, and then what they're doing right now. But she did tell me she's deathly afraid of what's going to happen come August 1. And her family's from here. She's from Hawaii, but she lives up in Korea.
Yeah.
Doc, just on a side note, have you heard of this a local boy from Hawaii? He's a 77 grad from Iolani. His name is Dr. Jerome Kim.
Yeah.
He's the one he's in Korea now at the International Vaccine Institute, right? Yeah, we're trying to get him on. We're trying to put feelers out there.
Well, I can give you feelers. I can give you his brother. His brother, I'm volunteering my time to help Le Jardin Academy here over on the ward side. His brother is Earl Kim, who is the headmaster of Le Jardin. And so, yeah, just call over to Le Jardin, and Earl is a terrific guy, and I've been just volunteering my time to help them do a reopening program. And so I was following some of the things that he was doing. Yeah, he's an Iolani grad and a Hawaii guy. Now he's over there in a very high influential position in the Korean government. So
because I read about the AIDS vaccine and his involvement, and how he got involved with that. I mean, his credits are like yours. It's just like, there's not enough room on one screen to read all the darn thing. And hopefully, it'll be good if from your side of it, and bring him on and have both of you folks on at the same time.
I'd be just honored to be on with him and listen to him and talk to him. So yeah, I mean, guys, I just don't know what the next couple days or weeks or months are going to bring for me, because I've just made this jump where I was recruited and pulled to help at a large level. And a lot of people have said to me, we need you here. And I'm like, no. Hawaii's my home. I am going to focus. I'm going to be here. I have a great team. I'm continuing to manage and run. But I mean, literally, I'm on a hold where I may be on a plane tomorrow. I could be on a plane tomorrow because, I'm now helping to lead some of these big programs, including, the pop-up hospitals and the quarantine centers. We're designing quarantine centers, and it's just something that it pulls me. We've never talked about my background, but my first 10 years of my career, wasn't in the military, but I spent it building a program within the U.S. military and in healthcare. And so I spent a lot of time dealing with different programs and dealing with staffing and integrating within government healthcare and services. And I got fortunate to have a bunch of different training where I'm able to do quarantine designs and different facilities to deal with infection control and, chemical warfare, those kind of things. So this is kind of a neat full circle for my career to be pulled back into this, let alone having the ability where, I just did the testing just because I saw the writing on the wall. We had to do it. And so I'm also fortunate to be designing the testing plans for multiple different states and counties. And right now we're working on one for the entire Department of Human Services, all 250,000 people across the world, because DHS is like all over the place. So, if I can help a lot of people, I'm very happy to help a lot of people. but I'm never going to take my eyes off of helping our people here and staying grounded, because this is my home. This is where my kids are born. It's my family, my friends, everything is here. But to be honest with you guys, one of the things what I'm really not complaining about the fact that I'm staying on mountain time, by the way. This is past my bedtime. I'll be up at 3 dealing with from the mainland. But one of the things why I'm really doing this and what's driving me is I want to go get more and more training and education just for the what ifs. What if we have this happen here? And I want to be prepared to really know what's going on. One of the other things, I'll throw this out to you. One of the other things I'm contemplating is if we get this pop tomorrow, which I'm expecting for one of these hospitals that need to be up in about 7 or 8 days, I'm contemplating to throw the opening to all the people in healthcare in Hawaii, because we heard it. We've heard it loud and clear every single day. Our hospitals are empty. Our ICUs are empty. We have capacity. I wouldn't mind taking 300 people, which is about what we'd need, and offering them, because these are pretty well paid positions and they take care of all your hotel, and they take care, you get about $100 per diem for food or $80 for food, and you get all the flights back and forth, plus you get paid a wage that's probably better than what we're getting paid here. And I wouldn't mind taking a team of 300 up there that are sitting there wondering where they're going to work or if they aren't working, just to train them to get prepared to help our state. You know, so I may be reaching out to you and say, hey guys, put the SOS out.
Okay. Wow.
Charlie would go to per diem, got to be a little more. The stipend for food would have to be a little bit more than $100 a day, but I'm sure he would. Hey, Doc, this is an off-the-cuff question, and I'm sure you've thought about this, but let's just say tomorrow, Governor Ige calls you up and says, hey, Doc, man, I'm in a pickle. You know, I think I may have strayed down the wrong direction. What is your suggestion? What do you think the state should do moving forward? And not the entire package, but let's just say schools. We got a lot of questions from viewers right now about schools, about kids and masks. But what would you tell Governor Ige if he asked you for your suggestions as it relates to an August 1st opening?
Well, I would say right off, push it to September 1st. Don't even talk or question. I think to even still keep it August 1st is just not practical for so many reasons. One, these people can't get tests, and it's just not practical. So I would say push it out because this situation has changed. Second thing I would say, shut your bars down, shut your restaurants down. Get people, go back to putting mandatory recommendations for 10 people or less in social gatherings, and start shutting down some non-essential things that where people are seeming to be gathering right now. It's one step before shutting it down to go to the process of work from home, where we literally just shut down everything. And then what you do is look for about a 2-week cycle, because we are getting our labs back in 24 hours. Look for about a 2-week cycle to see what our curves do. If we're complying and people are spending time. And if we're not, then the next step is that you got to go back to work from home. And I think one of the, I would say maybe mistakes we probably did is the conservatism that occurred with how long we kept the state shut down when we were having a very nice low trend, and we went on for 2 months with a low trend. We could have started easing it up back then, and I don't think that we would have had this massive burst out the door, finally free at last, kind of feeling. So I think that we need to see our numbers go back down and our trends go back down, and then we can do what I talked to you guys about before. We had the opportunity to be the safest place on the planet when we were down there at 0 and 1. And if we had done a 2-test program and we had everything in place, like the hotels were just buttoned up with testing, and the workers got tested, and our airports were safe, and we had this, we could really be inviting people who wanted a safe place to go on vacation. Now we're just in this weird place where we're just saying, oh, we're just going to go back to being Hawaii. No way, you can't do that. We have to do this in a modified way. And so that would be my recommendation right now. And then the next step after that is back to shutting it down. The next step after that is you're talking that the kids aren't going to go back to school. And, you know, we still have this little window. Do we just finish the 4th of July? You know, we could have a breath of light by September 1 if we take the next 7 weeks and go back to being a little smarter. Make
Hey,
sense?
yeah, let me ask you, you know, with regards to you know, the numbers that the lieutenant governor, he likes to go to his drawing board and he puts a little spike. Because of what we've been experiencing in the last week, that's sort of like you take that, really got to put it on the side, right? Because we're like in a whole new dimension now. Because it doesn't seem like it's, like you said, the curve. It doesn't seem like it's going this way. It's definitely going this way.
Sure. Well, you know, guys, you know, actually, while we were sitting here, I'm going to have to, as soon as I get back, I'm looking like I'm getting a call from Department of Health. I mean, I've been getting calls on positives all day. And what's really the most important factor that we need to talk about right now is,
Was that your dog?
yeah, dogs.
I heard a voice. Like, was that you, Doc?
No.
Okay, I thought your dog was asking you a question. I'm sorry.
Yeah, my dog's really smart. He wears glasses too. So, I'll bring him over so you can meet him again. So, but one of the things that isn't, although I'll give Bruce credit, he did talk about it a little bit. The positives we're finding are so random. And it wasn't like 3 or 4 weeks ago when we had your Kauai family over there, or a cluster here, or a cluster on the Big Island. They're just popping everywhere. They're just random for no reason whatsoever. And I can tell you they're at workplaces where there's groups of works. We saw the one down on the pier, which now we're working with testing all the people down there. I've got positives coming out of other healthcare environments. You know, there's a lot of one-offs all over the place. Now, what's scary about that? You guys get it. That means that every one of those people was spreading it to 2 or 3 other people, who was spreading it to 2 or 3 other people. And then the other thing, it's never talked about by our Department of Health, never discussed. It's like they deny it ever exists. And that's the 40% asymptomatic positives. You know, there's never an admission that, oh yeah, by the way, we need to find a way to test those people. Well, we are, you know, when I contact trace, like my positives today, all of those positives, we are basically already called them, talked to them this morning. I had them already over our urgent care. Had their families come in. We just tested them all. Anybody, we just got them in. If you were living in that same household, don't just go quarantine. Get in and get tested. See if you're positive, and then find out who you've been attached to and get them tested if they've been hanging out at your house. So we're not doing that.
I guess it's that multiplier factor you're talking about. That if we be conservative and just say 1 touch 2, that 2 now touches 4. You know, and the numbers just keep on growing. And you know, one thing that was said, and I think we kind of alluded to the fact last night, is I talked about the dragnet. You know, because as investigators, you kind of like go in with a surgical procedure, and you try to go right towards a certain, trying to find out who's is infected, and without branching off too far apart, you're trying to keep them concealed. But I think with what you're seeing now, and correct me if I'm wrong, I think that process now, you need to put the net as wide as possible and try to bring everything in, because it seems like it's climbing beyond what would be the norm to keep it in this circular position. It seems like it's outside of those fringes. Am I correct about that? No.
You're very correct. You are very, very correct. And you know, I'll give you an example. I had a positive last week. A wonderful patient, a God-fearing person that, you know, the day before we got the positive result back was at a church service with a couple hundred people, very close. And day before that was at a family function. I think it was either was either a birthday or a baby shower, and there was another 30 people. And all that time was having some low-grade symptoms, not really, not thinking that much about it, and then becomes positive. That one patient alone, there was probably, just off my quick count, probably 250, 300 close contacts in the same place.
Wow.
That's serious stuff. Serious stuff. How do you contact trace that? You know how you do? You announce it and you line them up and you test them all. But we didn't do that here. That's not our approach. You say, well, we'll just do a couple people in the family and the rest of them, oh, by the way, forget about it, never mind. No, that's not what you do. You have to test the entire facility. Anytime there's a cluster like that, you just have to go up and down and you test. And well, we still got some time. I don't want to go off in another rabbit hole, but one of the things I want to tell you, which is one of my the top things that I've been involved with that I want to write up in medical literature and give credit to them, but the staff and the teamwork that we had together with Holly Nani, 0 deaths. We are now getting to the point where everybody's being discharged from the hospitals, they're all coming back to the nursing homes. To have an outbreak, to be in the largest nursing home in our state and to not have one loss of life is just a credit to the staff down there and the teamwork that we put together with, and I give my staff are heroes, because we were there in 10, 12 hours and we tested 700-800 people. And here's another thing. Okay, we're in the nursing home. We tested the unit. We were able to help them design a quarantine unit because I had training in that. So we designed a quarantine unit and a hot zone, which is where the active patients were. But when we went to that unit, all the positives I was finding, all asymptomatic. All the nice little old ladies and men sitting there, and you're doing their swabs, and they weren't coughing, they didn't have any fever. And we went through, and I think it was 16 people in that one ward that were positive. Not a soul had a fever, not a soul had a runny nose or cough. Now, after we isolated them, they then, 4 or 5 of them ended up in the hospital because they did start to have some respiratory difficulty. But the fact that we rapidly responded, rapidly tested everyone, and I was on the news quoted, the way you do it is you test them, you quarantine, you isolate, you repeat it within 7 days. Some of the ward we did 3 days. You see if there's more positives. You go through 2 cycles of 2 weeks where you have no more positives, and you have eliminated the disease from the facility. And that is such a victory for us. It's a teaching lesson for all the skilled nursing homes and all the group living facilities of how we have to approach this. That's how we save lives, is aggressive management, aggressive quarantine, and aggressive isolation. And actually tomorrow I'm testifying with the House committee, and we're going to be talking about the big gap we have. And maybe it's a nice thing I did bring this up. Holly Nani, Craigside, those big places that we did testing in, they're really well run, they're really well financed, but we have about 3 to 4 lower levels of smaller care homes, some mom and pop homes. I am very worried about them, very, very worried about them. And I'd love for you guys to, get the word out on Kauai that, we need to have options for those people to be tested and to be evaluated. And the most important thing through this big group I'm working with now is doing all the nursing home quarantine, 400 in California. They did the Kirkland, Washington. So when I'm over Holly Nani, I had my design that I designed, and I called these guys who are these experts that are in the field. And I'm like, hey guys, here it is, FaceTime. This is what we want to do. And I was able to bring them right on and say, do it, you got it going. But it's so unusual to not lose life in that situation, but we need to get quarantine facilities available for all the islands in case our seniors to have the disease. We need to be careful. Yeah.
Well, congratulations on your work with that nursing home. And, a couple of things. Number one, contact tracing, vital. And then the speed of the response. You got there quick enough. You got everybody contained. You did the testing. That is what I'm afraid of here. I know for Kauai anyway. I work at the prosecutor's office. We have a very small office. My coworker is less than 6 feet away from me. We work in very close quarters. There's three of us in a very small office. We wear masks, but he came in direct contact with a positive person. One of the clusters on Kauai, he was there to serve him a summons. It was within 18 inches, 12 to 18 inches of the person. Very nice. It was he hung out. He wore his mask. My point in this is that that family, that whole house, 8 of the 12 people tested positive. He was not contacted by the state. He was not notified by anybody. It was just by chance, obviously our office is a couple of investigators in there. It was just by chance that we had, through our sources, found out where that home was. And then he realized he was just there the week prior. Jesus. So he had very close contact. He got tested. All of us in the office got tested, but it wasn't because of the contact tracing. It was because we found out that he was at a house that, but with no information from the state whatsoever. So that is my concern. Subsequent to that, obviously, with us asking the questions, found out there were gatherings that we relayed over to the Department of Health. My point is that if you don't have a quality contact tracing program and a rapid response team like yours in that situation, every day that goes by, you risk someone's health. So it's getting a contact tracing program that's awesome, and then the response team that can go out and do the testing.
Yes.
Do the testing immediately. And that is my fear that I don't think exists here on Kauai. And in fact, I know doesn't exist because of personal experience.
And guys, I'm doing this all on my own. I'm not getting supported by anybody for this. All these other state RFPs and everything that they're putting out, they're throwing all their CARES Act money to do what we're doing, which is called strike teams. And what I'm doing is following the national guidelines. And actually now they're turning to me to look at what we've done to say, can you replicate this? But the bottom line is that yes, the strike teams have to be right with the contact tracers. And the bottom line is, as soon as those contact tracers identify people that cross over that threshold where you've had that 10 to 15 minute exposure within this certain circle, there is a threshold time that we would identify that puts you at serious risk. They need to be tested. They need to be notified. They need to be tested. And in all fairness, contact tracing, it's not a perfect science. Let me bring this up because this is not talked about enough, and you guys are the perfect forum because you guys will understand this. Here's the other big fallacy with contact tracing. I get some of these people I call they're positive, and you can just hear it in their voices like, oh no, really I'm positive. And we're getting a lot of young people positive. They don't want to go tell their bosses. They don't want to go tell, like Uncle Jim, who's the owner of this, like, oh, by the way, I was with you and I'm positive. It's hard for some people to be fessing up and then saying, oh yeah, I was with this person, I'm positive. So there is a very, very, it's cultural, it's got social determinants of health tied in. And I will tell you without saying a location, I was called today about a individual who's Micronesian in a Micronesian household.
Yeah.
Whoever's going to do that contact tracing has to have sensitivity. You can't just throw any contact tracer on any person. There is an art of trying to be able to communicate appropriately with a person at the appropriate time in their life. We have not talked about this, and it needs to be discussed more. And I never hear it at the state level that there's that specificity to that.
Well, we brought it up one night because we know that, especially for the Micronesian community, they're very private, especially when you talk about government because I know with this contact tracing of the clusters, they brought in, I believe it was a consul general for Micronesia had to come in. But because that individual, even though it's one of them, That individual represents government. So guess what happened? Closed up. They don't want to talk.
Yeah.
But you got to get somebody who's like on the level, because we have a really good community leader that's head of the Salvation Army. You bring somebody like that in, and that goes to what you're saying. You know, it's somebody that they can relate to. But we know that with these contact traces, and we said this from time and time again, it takes a special person
Yes.
that has a skill set that once they see deception, they got to know how to push the envelope with the deception, because there's something that's being hidden. And that itself could be very, very detrimental to your overall investigation.
And I am talking to the dudes that know all about that, aren't I? So,
It's you got to gain their trust. You got to gain their trust, and you got to let them know how important it is for us to finish out the testing of the entire that whole spectrum of contact, because if not, people will die. And
That's
there's a way of doing that without scaring them to hell or making them feel guilty. But that's what the training should be. And it's like we know. I think Charlie and I we know what questions we got to ask, and we've done it long enough to know how to ask it. And in the case where examples where you may have to bring someone in, you bring them in. But these things got to be done in a it's got to be done quickly. It has to be done. That net has to capture everybody that came in contact with these people, and that's just what has to be done. And again, I go back to what Senator Donna Mercado Kim said on one of our shows. She said, "Hope is not a strategy."
Yeah, exactly.
Hope is not a strategy. We got to stop relying on hope. Hope is great. I have a lot of hope, but that's when you're putting together a strategy of how you're going to attack this horrible virus. Hope is not a strategy. It's not.
And in all fairness too, contact tracing is not the only strategy also. How much have we heard again and again and again and again, oh, contact tracing, that's all we hear about what we're doing for this. It's, well, we have contact tracing, so everybody should be comfortable and wash your hands and wear your mask. No, there's more to it. Is contact tracing important? But my point is, if you guys just said it, if you do the contact tracing, I want, in a perfect world, when you study contact tracing, it should be paralleled, should be completed within 12 hours, and the individual should be directed to be tested within that time period. And you don't have to be a doctor or an epidemiologist or a professional contact tracer to understand the effective nature of what that does. You've immediately identified those people, you've tested them, you have results back. And if you wait a week, look at the spread. How many people have they touched?
Doc, what you're saying is it goes hand in hand with what we always said about the quarantine program. And that is, when you come off the plane and you test the person on the airport and you tell them go back to their hotel room, you give them, instead of having that narrow corridor for them to stay within, you give them the opportunity to go sideways. And that's what we don't know. From the airport to the quarantine location, we don't know if they're coming in contact with anybody. Sad.
Well, let me tell you, I've been in contact with numerous people within the film industry to try to help open our Hawaii film industry about testing programs. And I just had conversations yesterday with the head of the commercials for filming commercials in Hawaii, which is a big industry. And we were really going back and forth and talking about how do you do it. And there's another point that you'll see I'll get to with this, but I said, for these guys, you're flying staff in from the mainland, you're maybe flying talent in, time is money. They could drop a lot of money for every day they're sitting idle. We're probably still paying these people. And, I said, if you wanted to set the perfect program up where you wanted to be careful, what you do is you get those people, they had their 3-day test beforehand, you get them off the plane, you put them in a van, you get yourself a house and rent yourself a house, put these people, cater their food in there, and then you do another set of testing on them, and then they're socially responsible. They're not going to Waikiki, and they're coming to your film site, and then you pick them right back up and you take them right back over there, and you do it again, and you feed them, and you pay that little extra money to keep these people out of harm's way. And that concept is is how you create some safe industry,
Yeah.
so.
Doc, there's a question about, and I know we're running a little past the time, but I want to ask you about this Army training that they're having on Oahu. I guess it'll be statewide. 5,000 Army troops from Hawaii, obviously, Louisiana, Thailand. I've seen this question pop up the last few nights. I just didn't have the opportunity to ask, but I have seen the report on it. Apparently, they're going to go forward with this. And it's not RIMPAC. RIMPAC was canceled, but this is Army training. Any thoughts on that?
Okay. Man, you guys are taking me through down all my rabbit holes that I've just been living in. All right. So I just came back, as everybody knows, from the mainland. I was in Washington, D.C. and dealing with all these programs. And first of all, I got tested as soon as I got off the plane. Literally, I'll be tested again on Thursday. And I was paranoid wearing my N95. I have very, very good masks. And I everything I just told you, I did. I went to this office building. I came back to my residence inn. I had my food sent. I got food sent in. I mean, I was never anywhere without my mask. But listen to this. Both flights, Honolulu, San Fran, DC, 100%, not a single empty seat, right? And my eyes are all over the place watching this. Was there social distancing? No. Was everybody wearing their mask? No. Some people have them down below their nose. And then on the plane, you don't have to have your mask on when you get food or a drink. You know how many people sat there and nursed one drink for an hour? I was just paying attention to all this. Now, I'm going to admit that in this consulting thing I had, my insistence was, from a safety standpoint, I got to sit in the front of the plane. I said, I'm not doing this unless you put me in business class. But even then, I was worried. On the way back, about 40% of the plane were obviously active duty, probably some of their families. And I love our soldiers, and we have, like I said, spend a lot of time working with them. But the bottom line is, these are young dudes, and they weren't really that great with their masks, and their buddies, and they weren't necessarily social distance. And this whole plane, they're just packing in and off. Again, flight was absolutely full. So, and they don't have to go to quarantine, right? They just bypass it all, and they have no quarantine. So I trust our government. I trust our military and I trust that there is some leadership to tell these people, hey, you got to listen. And I'm hoping they're testing them also. Am I concerned? Hell yeah, I'm concerned with an event like that. Yes, I am, very much so. And then, are these guys coming like off the base to go to the bars? Oh, that's not good. That wouldn't be good at all.
Yeah.
You remember one of the first visits you had with us? I posed a question and asked you, is this virus aerosolized? Mm-hmm. And at the time, it was still kind of like debatable. It was like, well, 6 feet down. And then I posted a Purdue study about the 767, because one of the questions is there enough positive pressure to take the virus, when it's emitted, when your droplets emit, to pull it down, because all the vacuum is at the bottom of the floor area. And I said, can't be if the thing can go like 16 rows front or back. I said, this thing, it's there. It's floating around.
Exactly. There's two really well done studies that we refer to when we talk about airplanes. And another one was a real-time study that we'll refer to actually back when there was SARS, which is a very similar virus. And they had the index case, and it showed on the plane actually how many people contracted it from that individual. And it was 10, 12 rows in one direction, 2 flight attendants, another 6, 8, 10 rows this way. And it was all over the place. So this old school thought that, we only have to talk about 2 rows in front, 2 rows behind. Wrong answer. Not for a very contagious respiratory virus, aerosolized, of course. Today, again, things that we who've been following this have been saying forever. This thing, of course, it's aerosolized. Of course, it sticks in the air. And, how long? Well, not forever, but yeah, you're going to get this from breathing. It's from breathing. I've said this to people. Yeah, wash your hands, of course. But that's small compared to the mask and the distancing. That's very small.
How safe is it? And well, this will be the last question. How safe is it to travel inter-island? 20-minute flight, half an hour flight, inter-island flights. I'm not sure what the seating capacity. I heard that they're not. While I hear the airlines say they're not filling up the planes, I'm hearing from passengers that they are. But is it the same threat whether it's a 20-minute flight versus a 4.5, 5 hour flight?
Most of our data puts serious exposure at 10 to 15 minutes within that circle, of air stagnation within a 6 feet of breathing and things like that. So, I mean, of course, inter-island is safer than flying to the mainland. But if you're sitting within a 2-seat area of someone who's actively shedding the virus, you got to be concerned. If you get noticed, you're on that flight, you better get tested. Yes, you could get it. Now, if you're on one end of the plane, the other person's at the other end of the plane, and you get to get off the plane first or something, you're probably less likely. And but yeah, I would feel safer neighbor island, but the long haul flights, they're just a disaster. They're just a disaster. If you have positive people flying here on vacation and coming now August, you could have 15, 20 people. Oh, and by the way, there's no temperature checks being done in the mainland. No one's checking anything when you get on the airport. It's business as usual on the airport. So somebody could be coming on that plane with a temperature of 102 and you'd have no idea. So, it's wide open.
Well, you heard it from the doc. I know that was a question from a viewer. Unless you gotta, I will not fly in a plane. I'm sorry, unless I have to. I haven't had that come up yet. I'd love to go see my kids. I'd love to get my kids to come home, but we're not doing it. We're not doing it because the airlines, we know at least United, we know American have said they're not going to follow the social distancing. They're going to sell out every seat 100%. They don't give a damn about us. So I'm not going on no airplane. I'm gonna treat this seriously because I think the worst is yet to come for us here in Hawaii. I really do. I hate to say that. I'm usually an optimist, but I got to tell you, watching the trends. Oh, I know what I was going to say prior. Dr. Kimball was on. He said Utah, 2 months ago, Utah was how Hawaii is. Hawaii was 2 months ago, and now they're blowing out of control. So,
yeah.
Don't let the low numbers fool anybody because at any given time, patient 31 in Korea, one person infected over 1,000 people at the end of the day. So
I'm going to go back to the airplane because somebody's going to be, I came up with this technique because I was just so freaking wigged out. So I got my N95 on, and eventually I'm like, oh, geez, I got to drink something. And so my technique was I blew in my mask, I blew all my air out. I took half a breath in my mask. I hurried up, lift the bottom of the mask, put the bottle, chugged the whole bottle of water, put it back down, and then I breathed. I mean, that's the only time I opened my mask. And, I wasn't interested in a morsel of food or anything. I was like, I'm not breathing one iota of this. I'm not taking any chances whatsoever. So,
it's not true. Isn't it true that excessive amounts of Heineken kills the coronavirus?
No, it's Corona beer.
Oh, Corona. Okay.
Yeah, Corona beer. It just kind of grabs the virus, and you're in good shape. And if you put a lime in, you don't have anything to worry about. So.
Well, Doc, thank you again. What's your closing thoughts for our viewers? And there's going to be a ton of them, but what's your closing thoughts, man?
It's what I've been saying in all my media appearances. Everybody's got to take personal responsibility. We just cannot rely on the government. And at the end of today, I know we have a lot of questions. We're asking our government, our leadership, for more leadership. But at the end of the day, every one of us can individually make a difference that will stop us from getting this disease. And don't hesitate to understand how important social distancing is and combination of your mask. I mean, those are so important. I'll take those two over washing your hands any day. I still want you to wash your hands, but I just want people to understand how important that is. And then the other thing is stand up and let your voices be heard. If we have another week or two and our numbers are going up, stand up, let your voices be heard that we cannot open our state up August 1st. You know, we have to take the health of our population and our people and our loved ones and our kapuna. It's more important than just, you know, getting a few people scrambling in here to try to open up. Not important.
Charles?
Well, I'd like to take this opportunity to thank you, first of all, Dr. Miscovich, for coming on. I knew it was going to be an eye-opening. And again, congratulations to you and all that you've done and where you're taking this to the next level. I appreciate it. And for our viewers out there, thank you for joining us. You know, I'm going to bring up a name. I swore I was never going to mention this name, but I heard this name repeated several times through a source, because we talked about, when I asked you the question, you know, who's calling the shots up there, and it's not the health department. This name kept on popping up, and I researched it, and I found out that this individual works for an airlines, but his name of Avi Manis keeps on popping up. Yeah. And that's one of the execs over at Hawaiian Airlines. Yeah. So you know, I don't know what the relationship is. I don't know what the person does. But, you know, for a source to tell me that he's pretty up there, it kind of makes me wonder if that's the person, you know, calling the shots, especially with the airlines industry. And it will be interesting to know, you know, because I think everyone in Hawaii has the right to know whether or not you're going to do anything about it. But just, you know, we're taxpayers. We vote you in, and, you know, we can vote you out. And I think everybody just wants to be safe. And I think, Doc, what you brought to the forefront is safety. I mean, you know, you don't have to preach to the choir. You got two ex-cops in front of you. That's all we preach is safety. And we want to make sure that the rest of everybody is safe. So, you know, to our viewers out there, tonight was another good lesson learned just by listening to Dr. Miscovich, along with the doctors we had the night before. And I mean, you know, all we can do is fill ourselves with enough knowledge that, like you said, if the numbers keep on going up, we got to stand up and, you know, be peaceful about it, but, you know, contact whoever we can and put the word out and say, hey, this needs to stop because this thing is not faring well. And I'm afraid it's going to get so bad that we are going to be collateral damage. Yeah. Whether we want to be it or not, we're going to be collateral damage.
Yeah. Yeah. And again, thank you guys. You know, you do see me on there and I listen and I comment. You know, 7, 8 o'clock, I've got you on. I'm not watching TV, man. I'm watching you guys. So you can shout out to me at any time if you need some comments posted. But yeah, thanks for what you're doing. You're really giving the people honesty. It's all we want, right? That's all we want. We don't want blabbling press conferences with the same, empty words. Look at us in the eyes and tell us the truth, right? And, that's why Josh is popular, because people feel it, that he's really trying to be honest with us. And that's all we want from our leadership. Tell the truth. It's not always going to be good news. It's not good news. Today was not good news, but did anybody portray that in that conference? No. Come on, just tell us the truth, right? So
that's great.
Yeah. Well, I'll just say, I have a YouTube channel. My YouTube channel is Mel Raposo. We put every single episode of our show on there. You can go on and for those of you that haven't been on, just go to YouTube, search Mel Raposo, and don't forget to subscribe and hit the little bell button so you get notified whenever we put up a new video. But if you go back to March 20, it was March 21st. That was the day the governor did his press conference. The first press conference about the quarantine and waiting 5 or 6 days to start it. There's a video that that if you, I come out and I say that this was so obvious that it was visitor related driven. And that has continued all the way through. It's almost 4 months later, 3.5 months later, and it was even more evident today. So what Dr. Miscovich is saying is, yes, we gotta make our voices heard. And we know that he's meeting with the mayors tomorrow. It's never too late to email. You can email our mayor@kauai.gov, let them know how you feel, so that when they meet with the governor tomorrow, all of your mayors, I don't know what your other mayors in the other counties, what their email is, but just let them know, we're not comfortable with what's going on, and we want to be safe.
Yep.
Don't be mad, just be real and say, we're not comfortable, we want to be safe, and we ask you to help keep us safe. That's all you got to say, because I think we're headed down a very dangerous path if we don't stop this crazy train. So Doc, always appreciate you on the show.
Yes.
Again, we had no idea what you were going to say. I kind of had a clue, but tomorrow night tomorrow night we step away from COVID. We're going to talk with our county clerk and our elections officer, Jade Tanegawa and Lyndon Yoshioka. And we're going to talk about all the new voting policies and processes in place as we approach the primary election. Thursday, I have an invitation out to Lieutenant Governor Josh Green. He hasn't responded yet. And on Friday, we have Minnie Cole from South Korea. So exciting week.
Yes.
I hope the Lieutenant Governor will join us on Thursday. I gave him an option of Thursday or Saturday. Wait and see what happens. I know he's a busy guy as well. But until then, tomorrow night, 7 o'clock. Doc, thank you very much.
See you guys.
Charlie, you have a wonderful evening. You guys stay safe. God bless. We love you guys.
Thanks. Take care, fellas. See the people.
Thank you.
Aloha.